Good afternoon, everyone. My name is Kelsey Heindel, and I'm a program coordinator in the MCW Office of Community Engagement. And welcome to the May edition of our monthly Community Engagement Spotlight Series. This is our last session before we are taking a break for the summer, but we will be back in August for our third season of CE Spotlight, so be on the lookout for more information about our upcoming guests. Please note that this session is being recorded. I'd first like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar freely to share comments or pose questions for our guests. We will be monitoring your questions throughout the session, so feel free to send them as they come to you. This monthly series features community partners and the important work they are doing for and with the community. We highlight their goals, motivations, and accomplishments in the ways that they have partnered with people and programs at MCW. To bring awareness to Better Hearing and Speech Month, we are honored to have Jill Van Calster, President and CEO of Hear Wisconsin, joining us as our featured guest today. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about Jill and the important work of Hear Wisconsin and introduce today's facilitator. Dr. Young.
Thanks so much, Kelsey. I'm still smiling from that wonderful music that was playing at the beginning. I like most attendees, I don't know what will be playing until it starts. So it's always a pleasant surprise for me. So great selection of music to start off today's Community Engagement Spotlight event. So I'd like to start by introducing our guest today, Jill Van Calster, who is the president and CEO of Hear Wisconsin, which was founded in 1926 with the mission to help infants, children, and adults who are deaf or hard of hearing by providing the support and services they need to live full, successful lives. Each year, Hear Wisconsin provides critical services to thousands of individuals through its early intervention program, adult day services, American Sign Language interpreting, Assistive Technology Center, and its Audiology Clinic. The organization is excited to also bring audiology and hearing conservation services to the community after launching Wisconsin's first Mobile Audiology Clinic, known as the MAC, in July of 2021. And it's a really amazing thing to see the Mobile Audiology Clinic. So please take advantage of the opportunity to see it. I've been able to tour the clinic, and it's pretty phenomenal. In her role at Hear Wisconsin, Jill has a broad scope of responsibilities, including management and oversight of the statewide nonprofit organization. She is a successful management professional with nearly 3 decades of experience serving high-profile nonprofit organizations. Jill is a success-driven leader with an entrepreneurial spirit and solid business sense for generating revenue by developing and creating innovative business opportunities. She attained her Master of Science degree in Nonprofit Management and Leadership from the University of Wisconsin-Milwaukee, her undergraduate degree from Mount Mary University, and has held several board positions in the community. Thank you, Jill, for being our featured spotlight guest today.
Thank you so much.
I would now like to introduce today's facilitator, Dr. Christina Runge. Dr. Runge is a professor of otolaryngology and director of the cochlear implant program at MCW. Chris's clinical and research interests include pediatric hearing disorders, genetics of hearing loss, and optimizing cochlear implant outcomes, and is just a phenomenal colleague to have. Chris, thank you for serving as our facilitator today, and I now turn it over to you.
Wonderful. Thank you so much. I am really, truly excited today to welcome Jill, and thank you so much, Dr. Young, and everyone in your office for having this wonderful platform to bring awareness of our community partners. So I'll start off with a little bit of my own history with Hear Wisconsin. And first, congratulations, May is Better Hearing and Speech Month. And so that's one great opportunity for us to talk a little bit more about hearing and the needs for our community. And so Jill, I actually looked it up. I joined the board of Here Wisconsin in 2009.
Okay.
And so I served on the board from 2009 until 2020. And as you know, I did have to step off with the pandemic and focus pretty much solely on physician well-being at the time. But so I've had a really great opportunity to see Jill and her leadership role at Here Wisconsin for about 3 years.
Mm-hmm.
And Here Wisconsin's still near and dear to my heart. And we still work closely together to do all the things we can together to make Here Wisconsin seen and heard and known in our community for the great work you do. So I would also like to then start off with talking a little bit about our community partnership together too.
Mm-hmm.
And so Here Wisconsin is a fantastic partner for MCW and our hospital partners. Here Wisconsin has so many, as Dr. Young alluded to, there are like so many different resources and opportunities that they have that we don't have at MCW or our hospital facilities. And so for us to take holistic, best care of our patients possible, anyone with hearing loss from children all the way through adults, then we refer, we talk to each other, we work together, because Milwaukee, if you have hearing loss, this is the best place to be because we can take care of you all holistically and your whole family. So, and Here Wisconsin is such a huge partner in that. So thank you, Jill, for Here Wisconsin and all you do. So.
Well, thank you, Chris. And I would be remiss if I didn't take this opportunity before we get going with our conversation to thank the Medical College of Wisconsin, and thank you, Dr. Young and Chris and Kelsey and all of you for allowing us during this special month to talk about our organization. As you know, it's near and dear to my heart too. So I'm really thankful for this opportunity to share what we do with all of your participants today.
Fantastic. So speaking of, why don't we jump right in? And I think, Jill, why don't we start with you talking a little bit about yourself and your role and everything too with Here Wisconsin.
Perfect. So I guess I've kind of come full circle because I was born, actually, lived and was raised in West Dallas, and that's where Here Wisconsin is located. So hopefully I will end my career here and we'll have ended it here. So I was raised in Milwaukee, as they stated, as Dr. Young stated, went to Mount Mary University, then to UWM, but in the middle there, I found mission-based work and found that was my calling. I always say, you know, not that there's anything wrong with making products or widgets, but it's not something that I was drawn to. I love doing work that impacts our community. For me, that's what makes me feel rewarded at the end of the day. So I started my career at a nonprofit membership organization in Brookfield. Best thing of my life, because that's where I met my husband, and we've just celebrated 27 years of marriage. He is still at that organization, but that's where I got my first start in the nonprofit sector. Left there, went to Children's Hospital of Wisconsin, so I worked there for about 6 years. Then went to Blue Cross Blue Shield when they were converting from a 100-year-old not-for-profit to a for-profit organization, and got some different experience there, but spent the bulk of my career at Curative Care Network, right out on the medical complex by the Medical College. Spent 13 years there and really loved that experience. Got some operational experience, ran some of their divisions, and left there as the Executive Vice President and Chief Operating Officer. But kind of felt like I wanted to start my own business. So I think was driving my family nuts, saying, what am I going to do now? What kind of business can I own? Because I really wanted to run it. I'd gotten kind of an inkling and, you know, running departments, and thought I wanted the next level challenge. So I left Curative and went to Wisconsin Philanthropy Network, which is really where I had the experience of getting to know all of our funders, all of our community foundations, corporate foundations. We were a membership organization that helped funders be responsible givers of money. I was the CEO and president and CEO there, but I really missed the work that we do every day. I mean, like you said in the beginning, you know, the people's lives that we're changing and the impact that we're making. And even though we helped funders, you know, be responsible funders, and they were the ones that gave money to the nonprofit organizations, I was really far away from the faces and the people. And the recruiter that hired me there, long story short, said, hey, come on over to here, Wisconsin. And I came and I toured and I saw our toddler group, which we will talk about a little bit later, and absolutely fell in love with this special organization and haven't looked back. So it's been, I'm on my 6th year. I started here in July of 2017. And I'm really, again, just excited to share with you guys what we do, because even though we have been serving the communities for 97 years, virtually no one has heard of us. So thank you again for giving us this platform. So that's me. I'm married. Our son and his wife are in Austin, Texas, and are due for their second child, a second girl, in 1 month. So,
oh my gosh, so
very exciting.
Oh, Jill, this is amazing. And I did know these things. I was on the board when you joined here, Wisconsin. And so the organization is so incredibly lucky to have you and all your skills. So
thank you.
That you're back with all the faces and making a difference.
Yes.
Every day. And so why don't we go ahead and share then, what would you like to start with as far as all the different opportunities that here Wisconsin has for our community?
Sure. So we, just so everyone knows, we actually have 6 divisions. I'm really just going to kind of talk about 4 of them today that I thought would be the most interesting to folks listening. Our 2 other programs are small. One is just an interpreter services division, and the other is a very niche program that we are very proud of, but it is a niche program, and that's one that helps adults who are intellectually disabled and use American Sign Language to communicate. So it's kind of like a day program. But I think we could start with since I brought up toddler group, we could talk about we call it the Kellogg Child and Family Program. So we have auditory verbal therapists, speech language pathologists, service coordinators on staff, and really we're the first line when parents have a child who is born deaf or hard of hearing and they get enrolled into the birth to 3 or early intervention program. Our therapists are the highly skilled therapists who work with those babies as little as 3 weeks old and help the parents and help the baby learn either American Sign Language or listening spoken language. And I know that our therapists are exceptionally proud of the fact that, unlike some of our colleagues nationwide, we offer parents both modes of communication. Sometimes they say if you go somewhere else in the country and you want sign language and that organization doesn't do listening spoken language, you'd have to go to a different organization. So we've got folks on staff who are fluent in sign language and obviously auditory. So they, with COVID, I know COVID is, nearing the end or ended and we didn't want to go there, but I think one of the truly amazing things that we did was the Kellogg program just acclimated instantly to tele-intervention. So we're doing therapy services with families, just like you and I are talking. And I think what was really amazing about that was that the outcomes that we had for those parents and those infants was as good or better than when the therapists were in their home. I think, just by virtue of parents not having a therapist in your living room, right? They kind of had to learn what to do and do it because the therapists weren't there. So we're really proud of that. Kind of got through all of that seamlessly. Our family still got the help that they needed. So we serve the whole state, and we've seen families in rural parts of Wisconsin by virtue of knowing how to do that.
That is so fantastic. And actually the key is so it's a toddler group, and like you said, from 3 weeks, because when you think about it, all the learning that's occurring when they're just little,
it's that time.
And from the very beginning. So you're in there helping these children learn speech and language and how to communicate in all the modalities, right? And so you work with the families with what works best for them. And you get these kids like what the stimulation and the speech and language development that they need from the very beginning, so that they don't fall further and further behind, which we know for children with hearing loss, that is the big risk, is the longer they go without that kind of stimulation, the harder it is for them to catch up in school and socially and everything else. So you're making the biggest difference for these families and these kids. So
yes, and getting them entering kindergarten on, par with their hearing peers. So you know, it's critically important work, and it does set them up for the entire rest of their life. And toddler group is amazing. We so miss the babies being in this building when things were shut down. And I know the entire organization was just thrilled when they came back, and obviously so were the parents. But yeah, having toddlers here, and I think what's really nice about our program too is it's very inclusive. So toddler group consists of toddlers who have hearing loss in addition to ones who do not. So parents who have children with normal hearing bring their little ones in to participate in the learning and helping the children with hearing loss learn as well. So it's really, I think it's a fantastic model, and it's a model that works. Yeah. So we're very proud of that.
Oh my gosh, that is, and it's so cute. There's so much,
right? Exactly.
I love that. I love it because I love that part too with their hearing peers there, and I think it's great for everybody. So the children with, you know, there's like some peer-to-peer. There's a lot of inclusivity. There's a lot of learning from one another, and I think for the hearing children too, to interact with other kids who might need a little bit more help in certain things. And
absolutely, to expose them to children who are different than them, even if they're, you know, 2 or 3 years old. I think starting them out on that path of understanding hearing differences and what that means sets them up for a really successful social setting in school too. I think it's just enhancing all of that type of learning, and like you said, inclusivity. It's good. Yep.
Wonderful. And that is something that you offer that we just don't have
right.
elsewhere. So again, that's another way we partner. And at MCW, we, for example, we would test the hearing, we would, you know, be able to fit hearing aids or cochlear implants or things, but then they can come to here, Wisconsin, to be immersed in this full development for their speech and language. And I just, it's just fantastic that we can partner that way. And so that's fantastic. So I don't want to rush you or anything, but if there's anything, so what would you like? Because again, we have a lot of things to talk about. What would you like to bring next?
Let's talk about our audiology clinic, because I think that's a way that we've partnered too. So I started here in 2017 in July, and I know that we were at that time when I came here, our audiology clinic was staffed by a medical college audiologist. So we were partnering with Med College because we were very new to audiology services. We hadn't really done them as an organization by ourselves. Partnered with you, and we're kind of getting audiology off the ground. And you and I had a conversation when that audiologist left. I know it was you. I turned to you on our board, and we were having the conversation about, is this a business line? Is this a program that here Wisconsin can maybe tackle by ourselves, right? And we decided to do that. So in 2018, we hired really our first here Wisconsin audiologist. So, you know, when I look at how we've grown since 2018, we've grown exponentially in our audiology clinic, and a lot of that was from getting set up properly and understanding the process of it with the medical college. So in 2018, we had one audiologist who was working 38 hours a week, and today we have 5 audiologists on staff. So, and part of that, we're going to talk about the growth of that was because of the mobile clinic, but our audiology clinic, you know, just like any audiology clinic, serves our community, a vast array of patients. Some are young, some have intellectual disabilities. A vast majority of our population, as you can imagine, are older folks. What's the statistic? I think 1 in 3 of us over age 65 have some form of hearing loss. So we have a thriving business. I think you know, a lot of our business is low income, obviously. So we serve a lot of low income patients, which is important. That's part of the mission-based work that we love to do. But our audiologists are, I think, driven to that mission as well. They really like the mission-based part of what we do. And another growth opportunity, we went from, I think, 2 audiologists to 5 because another community audiology clinic was closing. It was a nonprofit community clinic that was closing its doors, decided that they no longer could operate a community clinic. So we absorbed their patients. We didn't want those folks, obviously, to not have resources in the community. So that was a undertaking last year. And then, like I said, we've had pretty tremendous growth in trying to figure out how to maneuver the mobile clinic and its audiology services with our audiology clinic here. And as a new business, there's growing pains, right? You got to kind of figure that all out since we've only been doing this for 5 years. But that too is a program that we're really proud of, that we're in the arena along with medical college and serving people who need hearing healthcare.
Yeah, that's so fantastic. And it is, it's in the community,
Yep.
very accessible. You can park, walk right in, and it's a
Yes.
beautiful facility. So you have
Thank you.
gorgeous, if anyone has a chance to take a look or see what you have, it's absolutely gorgeous. And so, yeah, that's your brick and mortar piece.
Absolutely.
Certainly in your comprehensive hearing healthcare that you can offer there. So you did mention the Mobile Audiology Clinic. Would you like to talk? That's your the one on wheels, but would you want to talk about a little bit too?
It's kind of one of our most recent projects, and one that we you have these ideas, right? And for those of us in the field here, you come up with these ideas, you hope that they're gonna do what you want them to do and that it's gonna come to fruition, but we really didn't know. So as the CEO here, I belong to, it's called the Nonprofit Association of Speech and Hearing Centers. So it's a whole group of like 42 of us CEOs who run speech and hearing centers just like here, Wisconsin. And we get together twice a year and we talk about what we're doing and how we're serving, our populations as it relates to hearing loss. And many of them had a mobile clinic, and they use their mobile audiology clinic as a revenue generator. They built mobile clinics to go out and to test the hearing of workers in loud work environments. So OSHA regulates that if an employee works in an environment that has noise levels of 85 decibels or higher for a sustained period of time, that they annually have to check the hearing of their employees. So my peers were building their clinic to go out to get those contracts to get paid, and then it earned revenue to help to sustain the rest of their organization, right? It sounded brilliant. So after one of those meetings, I brought back that idea to our board of directors and to our staff, but we did a twist on ours. And it was because my head, again, is always kind of geared toward community service and serving the population, and how can we best do that? How can we get here, Wisconsin, who most people haven't heard of, out into the community in a more expanded way? So we built our mobile clinic entirely different than they built theirs. We did a fundraising campaign it literally started, I am not joking, in March of 2020. Yeah, that's what everybody does when I say that. They're like, okay, here it goes. Like that's just going to be the end of it. And we thought it really could have been, because obviously we needed to do a fundraising campaign to build this. But the community rallied around it, and we were able to build a mobile clinic that was twofold. So we have 2 audiometers on the mobile clinic, one to do the OSHA testing, but one to do clinical hearing evaluations, just like we can do in center here. So we're very thoughtful about how we built that, how we designed it, really making sure that our mobile clinic could go into the community, to low income areas, to areas where people didn't have access to hearing healthcare, but we could also contract with those businesses to get revenue to keep the mobile clinic on the road, doing the community service. So when we shared that with our funders, I think that really kind of helped them to realize that we had a sustainability piece, right? That we had thought that through and recognized that we weren't going to keep expecting or hoping that the community would help support this. So we launched it July of 2021, and it has been on the road now serving the community almost 2 years, which is shocking how time flies. But it has been an amazing benefit in the community. And I really want to share with people that I truly feel like this isn't our mobile clinic. This is our state's mobile clinic. We've taken it up to Hayward, Wisconsin. Our team spent 3 days on the Ojibwe Indian tribe, and we're doing free screenings for adults and children who didn't have access to hearing healthcare. We take it to festivals. We just partnered with the medical college and had it at your, what was that, Mega Cafe.
The Mega Science, the CTSI Mega Science Cafe downtown.
Yes.
Mm-hmm. Yep.
So I want folks who are listening to know that if you have a need in the community, because we're not aware of everywhere that, you know, someone would want the mobile clinic to come to. If you have a health fair, if you have a church, I don't know if you're aware of this, but Wisconsin is one of 7 states in our country that no longer mandates that we test the hearing of our kids in school. 38 other states in the country mandate that students get their hearing tested in school because it is so critically important. Wisconsin suggests or recommends that schools test the hearing of their kids. We know that MPS does, but there's a lot of charter schools, private schools, kids who are homeschooled who aren't getting their hearing tested. So we have been doing a tremendous amount of work doing free hearing screenings for schools across the state. And I think our statistic is about 17% of all the children that we have screened in the past year and a half have been referred for further evaluation. So we know that we're identifying kids that might not otherwise have been identified with hearing loss.
Wow. I mean, that's, yeah, that bowls me over that Wisconsin doesn't require that anymore.
I know.
I'm quite surprised because back in the day, I mean, Wisconsin was the first to mandate newborn hearing screening, and we were at the forefront of that, and everything too. So when you said that, that surprised me a lot. It's given me some ideas and things that
good. I
have
hope
some
so.
discussions about it at the state level. So and exactly. So when you do make these referrals, then and actually here, what I'd like to point out too is when you do a hearing screen for a child, it is also like, I think it's 20 or 25 dB. I'm not sure what the protocol exactly is that you're using, if it's 20 or 25 dB or decibels. So you present the beeps. I think we all kind of remember it was mandated when we were younger. So we all
it was.
remember being in school and having the headphones on, raising our hands, and there's a lot of background noise, so it's kind of iffy. But you can do this in this nice, quiet audiology clinic. So
absolutely.
But what's interesting is at the level that you screen, because it's typical, this is what you'd screen, but even catching that many, that's still like pretty loud for a child. So children like not able to, if they're not able to hear at 20 or 25 dB at any of the pitches that we're supposed to be hearing, that's actually quite a bit. That's like wearing an earplug or wearing 2 earplugs. So if anyone walks around during the day wearing earplugs, you'd realize that that's probably about a 20 to maybe 30 dB loss. And that's a lot. You miss a lot. And for kids, and they're in school and trying to pay attention, this is so huge still, because the other thing is if children are their school age, if they can't hear very well, sometimes they end up with behavior issues. They kind of mess around, they get frustrated, they don't know that they can't hear, they don't know how to express that. And so they can actually show up in a lot of different ways, and people don't know no one knows it's the hearing. They might think, oh, they're kind of naughty and put them in a corner, but they're actually, or they're sitting in the back of the room and they can't hear the teacher. And so they're missing so much, and they might not be doing as well in school, and nobody knows why. So what you're doing is actually figuring this out. And so the schools and the teachers and the families, everyone can put this together like, oh my gosh, there's a hearing issue that needs to be, and it doesn't necessarily mean sensorineural, like permanent sensorineural hearing loss necessarily, but they could have an ear infection or fluid in their ear that is acting like an earplug that nobody knows about, and they actually need to see a doctor.
Right.
So what you're doing is so huge. It's for the whole health and for the education for these children. It's like, it is off the charts. So thank you. I mean, that's so important that you're doing that.
So every time we send the mobile clinic out, we have, when we're screening students, if we're screening adults, we have a hearing conservation coordinator who is KAC certified. So he's went through the training, so can do the OSHA testing, but then he can also do just the basic screening, if you will, the 2-minute screening for adults. But whenever we are screening children, we make sure that we send an audiologist because of all the critical issues that you're talking about, right? That it could be something else. And want to make sure that we're not misidentifying something or telling parents that their child has hearing loss when they may not. So we take that very seriously as well. I don't know if this is going to throw a lug wrench into anything here, but is there any way that we could show, if we could share the screen and just show a couple pictures of the mobile clinic? Because I would love people to know what is available to them if they were interested. Otherwise, I'll just explain it verbally. But we have some pictures of the inside and the outside of the mobile clinic. So just so everyone knows, it's 36 feet long. So if anybody ever wants it to come to a place where they are, it takes a little space. I think it's, about 3 or 4, maybe even more car lengths. It is, there's the outside of, there's the outside of the mobile clinic. So it is pretty big. It is wheelchair accessible. So we made certain to put a lift on the vehicle. It has a full lab on it. So our audiologists, when they are on it, can fix hearing aids, put batteries in hearing aids, have access to all of their equipment that they would as if they were here in our clinic here. And the booth actually converts. So we can do one full hearing evaluation inside the booth, or it has stools. So when we do the OSHA testing, we can do 6 employees at one time. So this is also, I love being able to talk to people about this because getting those contracts is something that, that's a whole industry that we're not familiar with, right? Manufacturing companies, construction companies, printing companies, all of those companies are the ones who are mandated typically by OSHA to test the hearing of their employees. And we don't know who they all are. So if there's anyone listening, anyone who is watching this presentation, consider Hear Wisconsin. What we like to tell businesses is that when you choose us over the provider that you're currently using, you're helping to keep the mobile clinic out in the community and testing our students and going to assisted living facilities and going to homeless shelters and the Indian tribes. That's all keeping the mobile clinic able to do that kind of work. So I appreciate it. Thanks for putting up the slides. Those were great. Thank you. So I like people to know that too. That's an important piece of it, and keeps it going.
It really is. So, I mean, it's phenomenal, as you had described in the beginning. This is truly a mobile audiology clinic. It's not a screening tool or a screening clinic. It is full service. And because the other part too is the I think so it's doing the hearing testing, but like you said, you can serve as hearing aids, you can actually fit them. So the other component is, it's one thing to know if someone has difficulty hearing and they get referred, but it's a whole other thing to give people access to sound. And as we've talked about, right, the children, and how important it is for them to have access to sound, just for their speech and language development, their educational development, and how they're able to do that. But in some of these underserved communities and areas that just don't have access to this, being able to be in the community, and adults even, we talked about this at this Mega Science Cafe. Dr. David Friedland gave a talk on this as well, is there's relationship. If you don't have, that hearing loss, if you have hearing loss, you're at increased risk of developing dementia. There are all and other health issues that can impact the adult and the older population. And so, but there are studies coming out now that if you can address that, if you can get here, if you can get access to sound, if you can have amplification, that you might be able to to actually help stave that off. To stave off dementia, to make it so that it's not as bad. And again, trying to tease out if an older person has dementia or hearing loss is really difficult if you don't know what the status is, and if they can't hear you, it's almost impossible. So you're actually also giving people access to sound that they need it in the community if they can't otherwise get to places. Right. It's really amazing.
I think an important piece of that too is that you guys, I'm sure, are all aware of this statistic too, but what is the statistic that most people wait 7 years? They think they have hearing loss and they wait because there still, unfortunately, is the stigma with wearing hearing aids, not with glasses, but sometimes there's the stigma with a hearing aid. So what's really nice too is that the mobile clinic is going into the community, and we have had so many spouses kind of drag each other in and say, come on, let's just do a free screening. Let's see, because for some reason it's hard to get folks to come in and to do that hearing eval. And, so I think it does it in a friendly way. We're out in the community. It's not intrusive. It's, and it really is. I know that we're making a difference in our community, and more people are realizing how important unidentified hearing loss is, and that there are resources and services out there that can make you hear better. And that's the intent of why we do what we do, right? So
Well, and that was demonstrated by the success of the Mobile Audiology Clinic at the Mega Science Cafe.
Yeah.
We had about 24 people who attended the event or who were around the event at the time, and then did a call out, and a lot of people went home and brought their kids in. So, right. And so brought family members, like even during the day, like, and brought them in. Cause you're right. I think, calling the right number, setting up an appointment, like figuring all those things out is just, it can be just that much more of a barrier to people, even to even be seen. So that's fantastic. And I think, so let's see, we have about 10 minutes until we would take, I think some questions and things. I do see some in the chat.
Some questions,
really fun. So some questions popping up, and in fact, they're good and might generate discussion. So in the next few minutes, maybe if you want to describe the other aspects of Here Wisconsin that you want to share.
Sure. So just one more that I think is really important for the community, because most folks don't know about this one either. I honestly think this is one of the best kept secrets in our state. So we have our Assistive Technology Center. We have technology experts on staff, and this is where individuals can get assistive technology devices. So things like caption phones, amplified phones, bed shakers, visual fire alarms, any type of equipment like that. We've got the light systems that blink if a doorbell rings, all of that. But really importantly is that in the state of Wisconsin, there is the TEP voucher. So it's the TEPP voucher. And like I said, most individuals, unless they are in the field, haven't heard of this. And it's such a wonderful resource for people. It is a state organized voucher program. We all pay a small tax on our phone bills. It's through the Public Service Commission. It's the Telecommunications Equipment Purchase Program. And really what it allows is for individuals to receive phone-related equipment that helps them stay connected and helps them communicate. So things like an iPad, things like a smartphone. So whether it's an iPhone or a Samsung phone, a caption phone. Under this voucher program, they can get these pieces of equipment for low or no cost, virtually no cost. There is typically a $100 copay, but there's another state program that will kick in if someone can't afford that. And it's not income-based, and it, like I said, helps people get access to this equipment. And we have, so there's different vouchers. There is a voucher for someone who has hearing loss, but there's also a voucher, a higher level voucher for someone who has a speech impairment, so someone who isn't vocalizing or speaking. And then there's a mobility voucher, which allows for even higher level equipment that will help somebody who is non-ambulatory to access equipment. And our staff has been doing a lot of work with the Autism Society and with parents who have children with autism who sometimes aren't verbalizing. And we had a mother send us a letter and said that her daughter, 11-year-old daughter, wasn't vocalizing, had autism, and the mother accessed the voucher program, got her daughter an iPad. Our staff helped them put on apps that would vocalize for her daughter. And mom said that she went into a restaurant, and for the first time, her daughter was able to order her own breakfast, because she typed into her iPad what she wanted for breakfast. I want blueberry pancakes, orange juice, and bacon. And her mom said it changed her life. I mean, the independence that she has, and it's really meaningful work. And I go back to what I said in the beginning, without sounding hokey, this is why I do what I do. This is, when you hear those stories, and it's a state program that is there for people who need it. And my fear is always that, if we don't use these kinds of programs, that maybe the funding will get shifted somewhere else. And when I hear these stories about how we're impacting someone's life, or someone who might not be able to afford an iPhone can get one and be able to communicate and text with their family and friends, it can be life-changing. And, that's why I just love telling absolutely everybody I can about the TEP voucher program, and that it's not just for folks who are deaf or hard of hearing, but it's got those other two components to it as well. So I think it really just, exponentially increases the number of people who could benefit from this.
Oh gosh, that's fantastic. And I'm glad I'm wearing glasses, because I'm totally crying about that story.
Oh gosh. Oh, it's a good story. It really, Well, there's another one. There's a gentleman who we went to visit in his home. He's bedridden. The only thing he can move because of a disability he has are his eyes. And our staff found, I can't even describe it. I can't, but it's a pen. It's something attached to his computer that he can move with his eyes, and he can communicate. And it was like one of the most amazing impact stories that I've ever heard. And it was completely covered for him under this voucher program. So I always kind of save that story for the last, because even if I think the mobile clinic is, something that's really impacting lives, I think our Assistive Technology Center is like one of our hidden gems, and people don't know, but all you have to do is, you don't even have to call, don't have to make an appointment, just come on into our clinic in West Dallas, and we've got experts on staff who are fluent in American Sign Language, and also we have a Spanish speaking staff person, so we can virtually help anybody who needs to access these pieces of technology.
Oh, that's amazing. And so I guess that does in the like the last 4 minutes or so, how can people now that I'm crying, and then, and I know like a lot of ways to get involved, but how would you say like that people can get involved? How can they help? How can they
Absolutely.
Wisconsin? Like,
Yep. So people can help us in a lot of ways. I mean, certainly if you're interested in the mobile clinic, go to our website. It's here, hearwi.org. We've got a brief little form. You can schedule the mobile clinic to come out to your school or church. We have a fantastic event coming up in October. It's called Fall Fest. We are always looking for volunteers. I know you've been there. We have a petting zoo. It's open to the community. We open our doors. We've got food that we give to folks. There's balloon guys who come and make all the balloons for our little ones, make crazy animals out of balloons. But it's a wonderful opportunity to kind of get, affiliated with our organization. And like I said, we're always looking for people to cook the brats and cook the hamburgers and help watch the kids in the bouncy house and do all of those things. We also have a winter wonderland where we look for volunteers. That's again for our little ones in December. And certainly as a nonprofit organization, folks can donate to us, but we really value volunteers and don't unfortunately have enough people who know about us to come on out and volunteer. We are also looking, I'm going to throw this out because I'd be remiss if I didn't, we are looking for a very part-time, 1 day a week, maybe a day and a half a week, person who would want to drive the mobile clinic. Just 1 day a week, just drive it. You don't need a CDL license. And help us when we go to places in the community to relieve our hearing conservation coordinator, to have him stay back in the office and work on getting some of those OSHA contracts. So I think it'd be a great thing for someone retired maybe who'd want to volunteer.
That sounds like fun. Like
I'm
a few years from retiring, but I was like, if that
you roll up with the mobile clinic and people love it. I mean, it's been easy, and there's always an audiologist there, so he or she wouldn't have to do anything except greet people who are coming on the mobile clinic and get it down there and get it back safely. So
great. Oh, that sounds like fun. So well, I did see a number of questions and things in the chat. So I will go, I'll go up to the top and work my way down. So there's some welcome. So first question, it's so wonderful, the toddler program. So back to earlier, the toddler program is inclusive of hearing differences. Is that how your program has always been, or did it pivot based on learning? That would be a good way to do it.
That is an excellent question, and I don't know the answer, but I know that as long as I have been here, we've had hearing peers in it, and you wouldn't, maybe you would know too. I think it goes back a long way. Yeah, it
goes back a long way, and as you said, it's almost 100 years old here, Wisconsin. Period. But from what I recall, from even way back in 2009 and before, as a community partner, even before I was on the board, that there has been that diversity in hearing, so that normal hearing peers have been a part of it. I think that was part of the philosophy of forming the toddler group. So, yeah. And let's see.
Good question.
Oh yeah. Is there another? I don't know if anyone unmuted, but so yes, there's encouragement to go visit the Mobile Audiology Clinic. And I think, like you said, Jill, at Fall Fest, I think the Mobile Audiology Clinic is in the parking lot, and you can come and take a look. So
you can come, bring your family and get free hearing screenings. Yep, we have the MAC, we call it MAC open, and actually we look for volunteers for that too, just because we have the audiologist there actually doing more intensive testing if somebody wants it. So we need somebody to help coordinate that. And someone asked about ASL classes and if they're on hold again. We are so thrilled that we have just hired a culturally deaf gentleman who is helping out in toddler group, being a mentor to the families, and he is also teaching sign language. So we will be offering that again in summer. So stay tuned. It was really just, they were on hold obviously because of COVID, and really difficult to hire someone who could teach, but he just did a conversational American Sign Language for our staff. We had like a 6-week course, and he's amazing. So yeah, watch for that, and we'll have it back up and rolling in a couple months.
Great. And so that's on your website. People can find
it. Will be. Yep. It says it's on hold right now, but when it's available, yep, it'll be back on the website. And if anyone wants to get on our mailing list, you can do that on our website too, and then you'd automatically get sent this information. So.
Great. And there was a question about organizations working with you to book the clinic. And so, as you said, that you can just contact. So I like this idea, the food pantries. That's a good idea.
Yes, it's a great idea.
Yeah, because I know some food pantries offer, do it, like Frieden's, for example, does it at certain days. And so it's not necessarily just open all the time. So if the Mac was there, as we call it.
Yes, Mac, we do.
Or the nickname for it. Fantastic. And so I think, and so there are a lot of links in the chat.
Yeah, that's great. Thank you, Kelsey. Yes, yeah, that's amazing.
Fantastic. So, I guess I don't know if there's anything else that you wanted to add before we sort of wrap up, or if anyone has any other questions, this is the perfect time to ask Jill any other questions you may have. So I'm not sure.
And if there aren't any, I just want to say thank you again. It was so fun talking with you. And thank you for allowing me the opportunity to talk about Here Wisconsin. It's been an honor to spend this time with you and the folks who are listening. And we really appreciate it. You know that we appreciate you. So.
Oh, absolutely. Thank you. And I love it because, we've talked about a lot of best kept secrets today, yes. And Wisconsin being one, and then a few others, the TEP program. And yeah. Let's hope that is no longer a secret.
A secret, yes.
It's just the best kept.
Good. Best kept. We're spreading the word. All right. Well, thank you.
So thank you so much. So Dr. Young, I do see you back on camera. So however you'd like to wrap up today.
Great. Thanks so much. Thank you, Dr. Runge. Thank you, Jill. I think it was just phenomenal. I was typing also in the chat. I always learn more and more about Here Wisconsin. So glad we could be part of helping to spread the word about a fantastic organization. Please look to the slides here for the evaluation and learning a little bit more about Here Wisconsin. There are so many more ways that we can be partnering with these phenomenal organizations and really helping to improve health for everyone in our community. So thank you again for being our guest and our facilitator today. As Kelsey said at the beginning, we're taking a bit of a break for the summer. Hopefully everyone gets a chance to enjoy some wonderful summer weather, and we'll be resuming again in August. If you know of different community organizations or efforts that you would like us to highlight for the spotlight, please do reach out to us or to Kelsey. But please keep in mind that we're always, looking for these additional opportunities to talk more about these wonderful partnerships that we have. So with that, I say thank you again, and hopefully everyone has a wonderful evening, wonderful summer, and please reach out to us with more information, questions, and ways we can support your wonderful community engagement work. Thank you.
Thank you. Thank you so much, Dr. Young. I really appreciate it.
Thank you. Thank you, Jill. Thanks, Chris.
Thank you, Chris. Thank you, Kelsey.